Hi, I'm Caer Weber, and I'm a volunteer with the Mood Disorders Association of BC. I've been doing research and workshops and groups here at MDA over the past couple of years and exploring the whole topic of self-care, asking questions such as what is self-care and how do we benefit and why do we have so much trouble taking care of ourselves. And I've asked those questions of myself as well and used myself as a sort of laboratory rat, have you will, of my own experiences with self-care and what it means to me. I've found some new answers that I didn't have 2 years ago, and I would like to share some of those findings with you today. First of all, what I want to talk about is what self-care is not, in my opinion. And first of all, it is not about being selfish. Many people who come to my groups have said, I feel selfish taking care of myself and taking care of my own needs. And the only thing that's selfish is if we exclude other people's needs in a situation. Otherwise, we don't think it's selfish to take care of our own car, to put all the fluids that it needs to make sure it runs and it can get us from A to B. Why would we feel selfish about taking care of our own needs for the same reasons? I'm going to talk about selfishness in a minute again. The other thing I want to talk about is what self-care is not, and that is about shoulds or shouldn'ts. Many of us think that this is how we are supposed to take care of ourselves, or these are the things I'm not supposed to do. And when we focus on those kinds of things, we set ourselves up for disappointments. And feeling that we are somehow inadequate or wrong or we just don't have it right. When really what we need to be paying attention to is what we need right now. Which leads me into what self-care really is. First of all, basically it is about taking care of our needs. And some of those needs are very obvious and other needs maybe not so obvious. So let me talk about those first of all. So I'm talking about physical needs, of course. Like the car, we have to take care of our own physical bodies. We need food and rest. We need physical intimacy with other people. We need medical attention, dental attention, clean air. So all of those things we obviously have to take care of if we are going to get from A to B without falling apart. Another thing we need are our social needs. We need to feel connected to other people. We need to feel that we belong in some way to this world, or that at least one other person cares about us. Many people come to our MDA support groups for exactly this need, in order to connect with other people and feel a sense of belonging somewhere. We also have financial needs. We need to have enough resources to live comfortably. Many of us want to have the feeling of contributing to something, such as doing volunteer or paid work. And it might be in the form of taking care of another person. As long as we feel like we're contributing to society, many of us feel rewarded and satisfied by that. Another thing that we need is a sense of control and autonomy over our lives. We need to feel that we can make our own choices in our life and direct our own lives in our own lives in the way that we want to. But we also have unique needs. My son, who's 38, has to fall asleep with his tablet on every night with a movie or TV show on. That's how he sleeps. For me, it's the exact opposite. That would keep me awake all night. I know a woman who loves to sew by hand, and yet her skin is allergic to the nickel on sewing machines. So she has a very unique need where she has to go out and find special needles. So we all do need to accept that we've got very unique needs as well as many similar ones. I think even underneath taking care of our needs, that the real foundation of self-care is about the relationship we have with ourselves. And that's mostly in the form of self-acceptance. The more I can accept who I am and what I need, what I desire, what's important in my life, the easier my life is. When I'm in conflict with myself, then my mental health probably goes downwards. It's very difficult to be in conflict with ourselves and to still genuinely care about our own well-being. We also need to have self-compassion for ourselves. And that's a hard one for many of us, particularly when we look back in the past and we look at things we've done. We've made many mistakes along the way. And for many of us, that's hard to take, and we criticize ourselves and put ourselves down for those mistakes. And yet, at that moment that we took that action, we thought it was the right thing to do. It seemed like the best idea at that time. So we also need to find a way to forgive ourselves for those times where we made a mistake and look at it as a way of learning that, gee, that didn't work. I want to end with one more word about selfishness. I think that the most unselfish thing that we can do in the world is to take care of our own needs. When we satisfy our own needs, when we feel fulfilled, and not at the exclusion of anybody else's needs, and not in a way that causes us harm or anybody else harm, then we can be more accessible and more available to the world. If we can feel more compassionate towards ourselves, then we feel more compassionate to other people. We can feel a lot more generous when we ourselves feel grounded and whole and fulfilled in our life. Thank you.